We're a few minutes late today. It's a busy day, but it's always good to be here with you. And thank you for tuning in. As always, we'll be here next Wednesday at 1 o'clock and every Wednesday at 1 o'clock. If you haven't yet signed up for your daily email update, I really strongly encourage you to do it. Over 100,000 Rhode Islanders have signed up. You can go to governor.ri.gov. We'll send you a daily email every day with the basic information you need to know in order to stay informed about COVID-19 here in Rhode Island. Okay, we'll begin today, as I always do, with the data, and I'd ask you please to put the slides up, put the dashboard up. Yesterday, we performed over 9,500 tests, almost 10,000 tests in our little state. So that's a lot of testing. That should give you confidence. And we saw 145 new cases. That gives us a percent positive of 1.5%. So 9,500 tests, 145 new cases, percent positive of 1.5%. 1.5% is very low. It is stable. It is safe. It's where we want to be. Far below the 5% that the CDC has its eye on. And very sadly, you see places like Wisconsin now have a test positive rate of 20%. So if you look at how Rhode Island is doing relative to our neighbors and other states, you should all feel very proud of the 1.5%, and it should give you some sense of confidence. Having said that, very sadly, we had another death yesterday, so the virus continues to take lives, and we have to be as serious as ever in our efforts to keep ourselves safe. The goal of doing all of this testing is, of course, to quickly find the cases and get those folks into isolation and then quarantine their close contacts. And so you're going to see us performing 10,000 or more tests a day, and that's a good thing. Why I'm saying this because I don't want you to be alarmed by the fact that there's 145 cases. Of course, we always want fewer, but when you're performing 9,000 or 10,000 tests a day, you're going to see 100, 150 cases a day. But that, in a way, that's a good thing because we're finding the positives and isolating them. And that's what's allowing us to keep our economy going, keep our schools open, and keep our lives going and contain the virus. If you also look on your screen, you'll see an excellent trend for hospitalizations. The hospitalization trend is heading downwards, which is exactly what we want, from 70 2 weeks ago to 66 last week. The percent positive in new cases is trending up. So we have to keep our eye on it. And that, we want to look at these two metrics together. The percent positive is stable and excellent at 1.5%. Our new cases are inched up to about 92 per 100,000. So we want to keep our eye on that. But again, as I said, when you're testing so many people, you're going to see more cases. And we want to just keep that test positive below 2%. All of this being said, keep doing what you're doing. Keep your social group small. Try to interact with the same 15 people. Keep a social distance. Wear your mask at all times, especially if you can't be, more than 6 feet away from people. As we're increasing our economic activity, we're up to about 90% of our pre-COVID economy, which is great. We want to stay there and go higher. We have to keep following these directions so that we can keep our test positivity at around 1 to 1.5%. Okay, I want to talk for a minute about K through 12. On the subject of testing, I want to provide an update on the K through 12 testing system that is now in its 4th week of operation. Through the separate K through 12 system, we performed nearly 6,000 tests just through that K through 12 system. Of those 6,000 tests, we've identified 109 cases of COVID. So in the K through 12 testing system, the percent positive is about 2%. We've run over 1,400 tests on school staff and 4,200 tests on students. And we're continuing to ramp up every day. Of the 6,000 tests that we've performed, 2,500 were performed last week. I got the update last night on where we are. We're on path this week to even go above 2,500. So each week we'll be testing more and more people, students and teachers and school employees through the K through 12 system. We're prepared to scale. We can continue, we can do thousands more. So I want to encourage everybody to go to the K through 12 testing sites. Since school started, we've identified 260 cases in the K through 12 community among everyone, students, teachers, and staff. So I want to make something clear. Since school began, we've identified 260 cases in K through 12. But as I explained a minute ago, only 109 of those were identified in the K through 12 testing system. So the rest of those cases have been identified through non-K through 12 testing. People calling their primary care physician, people going to a health clinic, people getting tested elsewhere, which is of course fine, right? If you're sick, you call your doctor, you get tested, that's fine. I will ask you though, please, if you're if you're part of the K through 12 system, if you're a teacher, a guidance counselor, a coach, a student, a parent of a child who's in school, etc., it'd be great if you could use the K through 12 testing system. It's good for you because if you use that system, we can guarantee same-day testing. And if you're sick, same-day rapid results if you get tested early enough in the day. We're hearing from some people who say, I can't get a test done on the same day. I can't get it back on the same day. Well, that's because you're not going through the K through 12 system. I can't guarantee it same day if you call your doctor or go through another system. So I'm going to give you the phone number again for the designated K through 12 testing system. It's 844-857-1814. If you call that number, it's the best way to guarantee you'll get a test that very same day. And so far, we've been able to do that, and we have plenty of capacity for more. It also allows us to have a better handle on the system, how it's working, and really contain the virus in the K through 12 system. Also, wait times have gone down. It's a minute or two that you'll have to wait. So it's on the phone, 844-857-1814. If you wake up sick, if your kid gets sick during the day, if your child is sick, call that number, get them tested that day. The other thing to note, which I think is encouraging, is that of the 260 cases identified so far, half are from students and staff who have not set foot in a classroom this year. So of the 260 cases identified associated with school, the majority are from kids and teachers doing distance learning. They haven't been in schools. So if you're wondering, is it safe to be in school? The answer is yes, based upon our 4 weeks of experience. And by the way, that's in spite of the fact that the majority of students, teachers, and staff in the state of Rhode Island right now are back in school. 95 schools in Rhode Island have seen a positive case. But this is key. The overwhelming majority of these 95, in fact, 69 schools, have only had one case. That's fantastic. That means in all of those schools, the system is working. The testing system is working, the contact tracing system is working. We identify the test positive, we isolate the person, we do the quarantining of close contacts, and we haven't seen outbreaks. So it doesn't mean that we won't. And if and when there are outbreaks, we will handle them. We've become expert at that and keeping folks safe. But the bottom line is the systems are working and you should have confidence. For me, I look at these data all day, every day, at the end of the day, at the beginning of the day, and I'm looking for signs myself. I don't want to do this if it's not safe. I don't want your children in school if I can't say with confidence it's safe. We don't want teachers to have to go to work in school if we can't say with confidence that it's safe. So we are constantly looking, testing, is it working? Do we have to make changes? This data should give you some confidence. Children have been in school for more than a month. The majority of children are in person. We have seen some cases. We've seen a couple hundred. The majority are happening for children in virtual learning who've never stepped foot in a school building. And of the cases in the 95 schools, they're mostly one case per school because we can get to work and contain the cases. So I would say, I know this discussion around schools has created a lot of anxiety and uncertainty all over the country, by the way, and there's no perfect answer. But the last month has taught me we have a winning formula in Rhode Island, and the partnership that we have with schools and the work that we're doing is paying off, and people should feel confident that we have a good system. I will say it should also give you occasion, if you have a minute, to say thank you to a teacher, a principal, a superintendent, a member of the school committee, because this has all taken an extraordinary amount of work, effort, creativity, patience, and stick-to-itness. I've had the opportunity to visit a few schools so far, and they've impressed me every time. Every single school that I have seen has impressed me with their creativity, their commitment to these children who deserve us to work hard for them. And it's clear how much planning that these districts did all summer long. We didn't just wake up September 14th and say, let's go back to school. Superintendents, teachers, principals, they've been working all summer long. And I would just say to all of you, thank you, because it seems like your hard work is clearly paying off. And I wanted to say that. I also want to take a second this morning to say thank you to the Warwick Superintendent, Superintendent Thornton, and the Warwick School Committee. I have not hid the fact that I am very frustrated with the school committee in Warwick and the superintendent because I felt they made the wrong decision in not getting kids back to school in person, particularly the youngest kids. And today they deserve a great deal of credit because last night the committee voted at the superintendent's urging to get the kids back in school, starting with the children K through 5. And so they'll be over time moving these children to in-person, in-school education in the city of Warwick. Thank you. Thank you. You did the right thing. You did the right thing for the children and families in Warwick. I want to continue to push you to go a little further and get all children in school. But thank you for your leadership and for your hard work. This is just work. So next up is Pawtucket. Let's see if you can do the right thing for the kids in Pawtucket. It's not okay that you're not opening the schools in Pawtucket. The children will suffer. Many of them will suffer lifelong hardship if you don't try a little harder and get a little more creative and work a little harder to open the schools for these children, particularly the youngest children, particularly children who have special needs. These kids deserve it, and it is possible, and we will do whatever we can do to help you to get these children in school, in person, in Pawtucket. It's the right thing to do. It's happening all over the state. And the truth of the matter is the children who can least afford it, It is the poor Black and brown children in the city of Pawtucket. It is the kids who have learning differences. It is the kids whose parents can't help them at home. It is the children who don't have the money to buy a computer. It is the children who may or may not have the money to have a meal at home who will fall the furthest behind if you don't do your job and get them back in school. So I'm asking you to work with us, follow Warwick's lead, and get a little bit more creative and a little bit more determined and help get these children back in school. A special note to retired teachers. It's always hard for us to have enough substitutes. It is doubly or triply hard to have enough substitutes this year. And we've been hearing from a lot of districts, probably every district, is they're working hard, they're trying hard, but they need more teachers. They need more great teachers, particularly those who can support the virtual learning options. The reality is that even districts that are fully open for in-person learning, they still have children who are choosing to learn from home. You know, we're not forcing any parent to send their kid to school, so every district is having to provide virtual education. And that's just really incredibly difficult. It means they have to provide full in-person school for kids and also virtual for the children who are opting to stay home. And they need help. They've told us they need help. So today, I'm putting a call out to all retired teachers. We need your help. We're asking you to raise your hand and serve, help us out, and help the teachers out, and help the kids out. So if you're a retired teacher and have some space in your life, in your heart, in your day, please come back. Please consider coming back to be a substitute teacher. We need your help and support. The teachers need your help and support. And as I say, particularly consider helping us with virtual learning, because we just don't have enough teachers for the virtual learning. We have a lot of kids who've chosen that option, and we need your help. So please, if you can do it, we would greatly appreciate it. By the way, even if you're not a retired teacher, if you are looking for something new or have an interest in maybe becoming a substitute teacher, I'd ask you to consider doing that. We're spending an awful lot of time trying to find substitute teachers. I will say my heart goes out to these teachers now. The teachers who are in school teaching, you know, the regular teachers or teachers who are teaching virtually, these guys are stretched. They are stretched. They are stressed. They are working harder than ever. We need to help them. We need some more substitutes. So even if you have never been a teacher before, but you think you might be good at it, you have the willingness to learn, please help us out. The Department of Education has developed a free training program with the Highlander Institute to provide training for Rhode Islanders to start as substitute teachers this fall for in-person or virtual teaching. So consider it. We need the help. Throughout this crisis, I've been up here asking for nurses and other kind of service workers, physicians. The National Guard has been deployed. So I'm calling on all retired teachers or someone who's willing to be a substitute teacher. We'll provide you with the free training, and we need to get you in the classroom or virtually teaching our kids. Candidates who successfully complete the training course with Highlander, we will then include your name on a hiring list that the Department of Education is sharing all across the state with every school district, so your name could be picked from any school district. The substitute rates are set by the district at between $90 and $150 a day. So it's a good opportunity. You'll have a somewhat flexible work schedule, have an opportunity to make a little money and help our kids and support our teachers at a time that we need you. If that appeals to you, I would ask you to go to the website backtoschoolri.com, and there's information on all of this. Back to School RI, information on this opportunity if you want to be a substitute teacher. Okay, switching gears for a minute away from schools, I want to make a quick but exciting and positive jobs announcement. I think we could all use some positive news every once in a while. So a couple of weeks ago, I announced that a tech company called Infosys had committed to hiring an additional 500 Rhode Islanders here in their Providence location over the next couple of years. And that was fantastic. Infosys has been a great partner to Rhode Island. They built the Crush COVID app with our team. They've been great. Today, I want you to know they're serious about this hiring and they're not wasting any time. Right now, as of today, Infosys has 150 jobs posted that they're looking to fill immediately. So if you're out of work and you need a job, looking for a different job or a better job, looking to change your career, you might check this out. It's 150 pretty good paying jobs available now in Providence. Go to their website, infosys.com/Rhode Island, and apply, put your name in. If you think you don't have the skills, apply anyway, because you might be eligible for the Back to Work Training Initiative, which we've launched with our COVID stimulus monies. So if you're an unemployed Rhode Islander, if you lost your job through COVID, check this out, infosys.com/Rhode Island. If you don't have the skills, go to the Back to Work. It's free training, and there's a job at the end of the tunnel. So I hope this is some relief. And again, this is the first 150 of 500. And I think I happen to know that these are pretty well-paying jobs, and they want to hire Rhode Islanders. Switching topics again, I would like to say a couple of words about the vaccine. I think I'm asked at least once a day, hey, Gov, what do you think about the vaccine? So I want to start to talk about it here. Let me say this. I don't know when the vaccine will be here. I do not have a crystal ball, and I'm not going to tell you something that I'm not sure of. I know there's a lot of concern about it. I know there's a lot of uncertainty and a ton of information and misinformation flying all around the internet and cable news. So this is my commitment to you, the people of Rhode Island, which is what I have done from day one during this crisis. I promise to tell you the truth. I promise to be fully transparent with you. I promise to tell you everything I know when I know it. And if things change, when they change, I'll tell you about that too. From day one, I have said to you, come here for your information. Try to tune out the noise, try to tune out the politics, try to tune out whatever you're hearing on social media or even on national TV. Come right here for your news. It's the same thing for the vaccine. We're not going to put a vaccine out to the people of Rhode Island until it is ready, until it is scientifically validated, until it is safe, and until we know it's effective. Not going to do it. And when that's going to be, I don't know today, but we are on it. We are all over it. I have a team working on the vaccine already, and it's top of mind for us. At this point, no one knows. So anyone who tells you they do, I'd be skeptical. So we are constantly talking to the federal government, the CDC, the FDA, scientific experts, other states, private industry leaders to be as smart as possible and get the most information that we can so I can provide the people of Rhode Island with good guidance. I'm also announcing today that we intend to devote tens of millions of dollars of our CARES Act funding and FEMA dollars to make sure we have adequate resources to distribute the vaccine in Rhode Island. And because that's vital, obviously, that's important. I don't know exactly how much. I don't know if it's 10 or 30 million, but we're reserving tens of millions. We're solidifying that number now because we want to make sure in Rhode Island, everybody has access to the vaccine, regardless of where you live, rich or poor, immigration status, your neighborhood, whether or not you have insurance. We want to take care of you, and we need it to be safe and effective. So through the work we already have ongoing, we will put together a statewide Rhode Island plan for the vaccine. Here's the good news. Rhode Island is excellent at distributing vaccines and getting people immunized. For a long time, we've been excellent. For the flu vaccine every year, for child immunizations, Rhode Island consistently ranks at the top. Part of that is because we have a governing structure that's already in place, pre-COVID, long pre-COVID, called the State's Vaccine Advisory Committee. It's apolitical, it's existed for years, and it has a track record of success. So today, in addition to announcing that we're already planning our vaccine distribution plans and we're earmarking CARES Fund to do it, I'm also announcing that I'm convening a special subcommittee of the State's Vaccine Advisory Committee that has the sole focus of evaluating and planning for the COVID-19 vaccine distribution. The subcommittee is comprised of epidemiologists, primary care providers, pharmacists, pediatricians, long-term care advocates, ethicists, nonprofit leaders, school leaders, faith leaders, and others. They're going to be tasked with two specific things. First, the subcommittee will be responsible for developing an independent Rhode Island-specific process for evaluating the safety and efficacy of the vaccine. By the way, I suspect there'll be more than one vaccine. There are 6 now in later stage trials. So if there's 1, if there's 6, we don't know. Each vaccine, before it will be distributed and made available in the state of Rhode Island, is going to go through a separate scientific evaluation process for safety and efficacy here in the state of Rhode Island by our experts on the state's Vaccine Advisory Committee. And as I explained, it's a broad-ranging committee. By the way, the full list of names of people on the vaccine subcommittee will be today posted online on the Department of Health's website. Secondly, the subcommittee is going to advise us on how to prioritize distribution of the vaccine and to make sure we give ourselves the best chance of protecting Rhode Islanders to speed up our recovery. I will say I feel very lucky to have so many experts. You'll see the list. I'm not going to read the list now because it'll take too long, but you'll see the list later online. It's pediatricians, public health experts, scientists, epidemiologists, folks who really know their stuff. You have to remember, all the details of the trials will be public. All the scientific evidence will be public. So they're going to have access to all the information they will need in order to make a determination as to whether these vaccines are effective enough and safe enough. And I promise you that we're going to do that here before we do any distribution. And as I said, I feel quite lucky to have so many experts in Rhode Island, and And candidly, the fact is the Rhode Island Department of Health has been a leader for decades. Before me, before Dr. Scott, before COVID, at doing exactly this, immunizations in an expert way. And so you should take heart in that. Having said all of that, a vaccine is not a silver bullet. First, we have to get it. Then we have to distribute it. Many of these vaccines that are in trials require 2 shots. It's a kind of a booster shot. So you have 1 shot and then another in 30 days. There has to be enough available to be able to vaccinate everyone in the state of Rhode Island. And it does, take some time to build up immunity in our population. So what's the bottom line is this. We're thinking about it, we are planning for it, and I want to be ahead of the game. I promise you we're going to be at the top of the line with every other state. So Rhode Island gets treated as well as or better than other states. We're planning now, so we are fully prepared. I'm not waiting for these vaccines to be ready. We're planning now. But I do want you to know, even when the vaccine is released, you still have to wear your masks. We're still going to have some amount of regulations to limit large crowds, big weddings, big conferences, big gatherings. We're still going to have to be thoughtful and careful about our social gathering sizes until we've had time to, fully vaccinate and develop kind of broad immunity in Rhode Island's population. And I do know there's a huge amount of anxiety about this and entirely too much politics. I'll tell you this, I won't ask you to do anything I wouldn't do. So I will plan to be vaccinated myself and my family and my children, and I'm gonna look out for you the same way I do my own loved ones. And you can be sure that the information you get here is information that you can trust. And you can also be sure that when we get to the business of distributing a vaccine, we're gonna do it with an equity lens in the same way we have met the needs of COVID the whole way through. An equity lens in that distribution to make sure that everyone is treated fairly and safely. So with that, I'll turn it over to Nicole and come back for questions.
Thank you, Governor. Good afternoon, everyone. Happy fall and happy October. I have a different mask today. This is my Breast Cancer Awareness Month mask. So it allows me to use it as a reminder to please talk to your doctor about getting screened if you are older than 40 or if you have a family history of breast cancer. And thank you to Rhode Island Medical Imaging for the mask and for all they do to support breast health for people in every zip code throughout the state. I also want to echo the governor's expression of gratitude as we launch this subcommittee to the Vaccine Advisory Committee focusing on the COVID-19 vaccine. We are truly blessed in Rhode Island. I can say firsthand that everyone that we called as experts to join this committee was eager and ready to serve, knowing how much we have before us to make sure that Rhode Islanders can rely on a fair, science and data-driven distribution process for everyone that needs it most going forward. So it's something that I also want to express appreciation to all of our subcommittee members who will be joining with us in serving. In terms of our COVID-19 data for today, as the governor shared, we have 145 new cases. There are 107 people currently hospitalized with COVID-19 in Rhode Island. Of those people, 10 are in an intensive care unit and 5 are on a ventilator. Sadly, we have one new fatality to report today. This individual was in their 80s. Our prayers are with this person's family as well as all the families who have had to deal with a passing during this time, which isn't easy at all. As Governor Raimondo also shared, we are keeping a very close eye on our number of new cases. Our percent positivity is strong because of the amount of testing that's being done, but it's important that everyone stays vigilant. It can get tiring, the days can be long. COVID does not change in how it is transmitting. Those 3 W's, wearing your mask, watching your distance, and washing your hands, continue to be the core approach to keeping us all safe. To share a little bit more about the data, as it's important to dig into what we are seeing from the cases and share it with you in real time, social gatherings continue to be a problem area. And one of the main reasons is when people are socially gathering, they forget those 3 W's and think it's because it's a family member or someone that they know or that they work closely with or live near, that washing their hands, wearing their mask, or watching their distance is no longer as important because of the closeness to that individual. And we want to make sure that you know to change that. COVID does not care if they are a family member or a close friend or a close coworker. Wearing your mask, watching your distance, and washing your hands regularly continue to be the key, particularly with social gatherings. Between September 22nd and September 28th, we identified 719 new cases. 49 of those cases reported attending social gatherings, and as I've said in the past, people are not always totally forthcoming with us about whether they have attended a gathering. So the number could certainly be higher. And we still want to encourage you, share the information with us that's needed to help keep you safe. The people who went to social gatherings had an average of 6.5 contacts. In comparison, the number for the average positive case is just 5 contacts. And if your social gatherings are happening in nightclubs, bars, other places, that's an even bigger problem. Nightclubs specifically should not be operating right now. Our state compliance team is going to be taking a closer look at this issue in the coming weeks, and we'll be sharing more on that shortly. 2 other things that are coming up in our case investigations are about break rooms and carpooling. If you manage a workplace and have a break room but don't need it, please close it. If you have a break room but you do need to use it, please have clear policies in place. Again, a break room is a location where people are gathering socially and forgetting the 3 W's. You need to still be wearing your mask when you're at the water fountain or getting something in the break room or just relaxing with colleagues. You have to continue to wear your mask. COVID, we have been seeing cases where people are in break rooms, their guards are down, and COVID transmission has occurred. In addition to wearing your mask, washing your hands, and watching your distance, keeping 6 feet between you and others, we're also asking people to keep a 4th W in mind. Also, watch your symptoms. If you have symptoms, don't go out unless you are going to get tested to further evaluate. In terms of carpooling, if you have to carpool, keep your mask on while in the car and keep the windows open. And of course, the most important piece is please stay home if you're sick. We have a range of income supports for workers who cannot go to work because they have symptoms or because they have to quarantine. There is a federal paid leave policy that applies to all employees at firms with fewer than 500 employees. And we have state policies that provide paid sick days and temporary disability insurance. Independent contractors are also eligible for pandemic unemployment insurance if they must miss work while they quarantine or isolate. And undocumented workers can access We Are One funds at any point. This is important to make known to people. The We Are One Relief Fund provides direct cash assistance to Rhode Islanders who are unable to benefit from most public programs and emergency relief efforts due to their immigration status. Please spread the word on that. If you need to learn more, you can reach out to Dorcas International or call us at our information line, 401-222-8022, and we will give you that information. In terms of schools, roughly 3 to 4 weeks in, we have fortunately not seen any major groupings of cases in K through 12 schools in Rhode Island, as the governor said. We are continuing to work with school and LEA leadership to make adjustments so we can better support them. We're extremely appreciative of their partnership, and it's what Rhode Islanders can look to with confidence in knowing how collaboratively and how strongly we're working together across the whole state of government response. As a reminder, we have dedicated K through 12 testing through the program that's available for any student, teacher, or school staff person to take advantage of. To schedule a test, call 844-857-1814. That's particularly those who have symptoms, or if you've been instructed by the Rhode Island Department of Health to call because you have been a contact. If you are a contact and you don't have symptoms, you will get a PCR test alone. If you do have symptoms, you will get that PCR test, and you will also get a more rapid test, which will allow us to start the contact tracing process more quickly if it turns out that you are positive. These more rapid tests are usually antigen tests, which are currently being processed by Eastside Clinical Laboratory. I want to give a special shout out and thank you to such a strong partner at Eastside Clinical Laboratory. They are a great Rhode Island company that has been a huge part of our state's response almost since day one, and we will stay connected in continuing a strong response going forward. The other educational environment that we're paying very close attention to is colleges and universities. Most of the college cases that we are seeing are still associated with congregate living, communal living settings where people are living closely together. However, I want to assure people that we are heavily involved with college and university leadership whenever we see cases. For example, we've been working with the leadership at Johnson & Wales to ensure that learning is happening remotely for the time being, and to get a stay-at-home directive that's been in place this week so that we can better understand the way to keep any cases under control specifically for that area. Similarly, URI has been working hard to stay in front of the cases that they have. And at Providence College, they're doing a 4th round of testing in advance of starting to move towards reopening after their case numbers have begun to stabilize. So we're going to be living with this virus for a long time going forward. We expect to see cases, especially among college students who are more mobile, as well as among those who live in congregate or communal settings. But with the steps that we're saying, it is possible for us to live with this safely. Watching your distance, washing your hands, and wearing your mask. I want to thank the leadership at all of the colleges and universities who have acted swiftly and decisively in each instance where we've engaged together. And the leadership at schools without large numbers of cases are being extremely vigilant as well. So kudos to all of them, and we will continue that partnership going forward. With that, I will open things up for questions.
Regarding nightclubs, it sounds as if perhaps nightclubs are using some loophole to stay open, and maybe you're looking at closing those. Can you give us more insight on what's going on with nightclubs?
Well, a key component is that nightclubs should be closed. We know that transmission is higher in those types of social gathering settings, which nightclubs cultivate. Any locality that has a bar needs to be following the rules that we have in place for bars. And it's really having the public understand from a shared responsibility standpoint, avoiding crowded places where people are coming together unmasked, closer than 6 feet, not washing their hands is critical to protect yourself and your loved ones and stopping transmission of COVID-19.
Governor, there's a situation with the North Providence schools at the beginning of the week where there seems to be some kind of miscommunication and a back and forth over who called who. But at a minimum, it seems like at best messages were left. Are you looking at that? Does there need to be a better system of notifying schools and making sure either a kid who's sick or was a contact doesn't go to school?
Yes. Yes, we are looking at it, and yes, we're looking to improve. The superintendent said, and I appreciate it, that overall, the response from the Department of Health in the past month has been excellent. So that's a good news. But in this instance, it could have been better. So we're going through in some detail to figure out, okay, how could have we improved that process? Maybe we should all have incorporated cell phones. Maybe, so short answer is we're trying to get better. We will get better. We've only been at it for a month. And we're digging into the process to figure out how to make sure that won't happen again.
And if I could just follow up on the schools, I know you made the case today that since a majority of the cases have been in kids and staff who are at home for virtual learning, that schools are safe. I'm guessing some people may see that and say, well, if those people are home, they're not hurting anybody, so why not move more people home? I know there's still a vocal group of teachers on social media, particularly in Providence, who still want to push to more remote learning because of staffing shortages, cases in schools, PPE, cleaning, and stuff like that.
Yeah. So I would say the reason to believe it's safe to go to school is because we've been at it now for a month. The majority of kids are in school, and we haven't had outbreaks. We're not seeing spread in schools. The testing's working, the contact tracing's working. We've seen cases. We will continue to see cases, but we've limited the spread of the cases. Like I said, in most cases, it's been one case per school. So that's, the reason. I think in Providence, for example, in the lower schools, they have a cleaning person on every floor of every school. So we're pretty serious about cleaning and keeping people safe. Also, to answer your question, I don't think that's true. Like the fact that the children are getting sick at a higher rate tells you they're not staying at home. They are doing what people do. They go to the grocery store, they go to the park, maybe they're playing sports. Maybe they're, doing whatever they're doing to get infected, and then they're spreading that infection to everyone else. So I don't think that follows the logic that you were suggesting.
Governor, President Donald Trump yesterday called off the conversations or negotiations with Congress about a further stimulus package, and now today is calling for what Democratic leadership calls a piecemeal approach of maybe just stimulus checks. What's your take on all of this, and where does this leave the state in its financial picture?
Yeah.
And I have a follow-up.
So I did see that. It was off, it was on, it was off. Stock market futures went down, so it was back on again. My message to President Trump is we need some certainty. Just tell us. Anyone in business will tell you that. Just give us some predictability. I'll tell you, Rhode Island needs a stimulus. If we don't get a stimulus, it's going to be awful. Layoffs like we've never seen in public service, cuts to healthcare, cuts to education, horrible choices that nobody, including myself, wants to make. So I'm crystal clear about that. Our federal delegation, just this week, I've talked to Senator Reid, I've talked to Congressman Cicilline, they're on it. But the message to the president is, do something and give us some predictability. So what am I doing right now? What we are doing is we're making scenario plans for every eventuality. How are we going to balance the budget if we get no more stimulus? How are we going to balance the budget if we just get flexibility with the existing money we have? all the different variations. But the bottom line is, come on, like, do your job, be serious, give us some certainty, give us some predictability, send us a stimulus, let us know how much, so we can get to the serious work of planning Rhode Island's budget.
You opened by saying that Rhode Island has returned to 90, I believe you said 90%.
That's
of it. How do you figure that? How do you arrive at that?
I think it's that composite measure that Moody's has used, where they look across GDP, jobs, job creation, unemployment, and it's about 90%. Obviously, it is not 90% in retail, hospitality, accommodation, but in every other, there's a lot of businesses that are at 100 or 100+%.
What do you tell those people who are in those sectors that are far from recovery?
Yeah, I tell them, hang on, to get through this. If you're a restaurant, this is about survival. Apply for Take It Outside grant, apply for Restore Our Eye grant, apply for unemployment insurance. And I'm doing everything I can to get as much of these, keep as much of the economy open as possible.
And if I might.
I also would say this, please. If you're out of work and you're worried that your job might not come back, if you're a cashier who worked at a big retailer and you've been furloughed and you're getting nervous that that retailer just, might not take you back, go to the Back to Work website, get some job training, and let's get you a new job.
If I might, we've had calls to some of our talk shows, people saying they're getting pressured to repay some of these loans that they've taken. Are you aware of this?
I'm not.
I don't know the specific instance.
I'll follow up with you. I'm not.
Yeah, I don't.
Those are earlier bridge loans, not the Restore Our Eye grant that's happening now.
So I'll look into it, Steve. I don't know.
Thank you.
So Governor, what is, I feel like we've had this conversation since June, where, all right, we'll see in a month, hopefully the stimulus is going to come in at the end of July and so on and so forth. Now we're heading into the winter. You mentioned nightclubs, Doctor, and I know that there's a lot of music clubs that have done what they can outdoors, and there's restaurants now downtown. They're packing up blankets today. The Rhode Island Hospitality Association trying to encourage people to go to restaurants and eat outdoors with blankets, but we've got to be coming to a head with all of this as the cold weather comes. So if there is no additional stimulus, will you release CARES Fund dollars to these businesses ahead of the winter? Is that something that from their, so they have some kind of
I thought you were going to a different place. Maybe. However, again, I'm as frustrated as you. This is why I just wish the Trump administration would just give us some certainty. Let me know what I have to deal with so we can get to work. If there's no stimulus, but if we're allowed to use our existing funds to make up for the fact that our revenue is so far down, then I think, of course, I'm going to work with the legislature, and we're going back into session in November to try to do this work. But then I think you have to say, use some of the stimulus to prevent cuts to healthcare, cuts to healthcare access, cuts to mental health, cuts to education, and also possibly giving more money to businesses. So my answer is, which is not satisfying for you, is yes, I am open to doing that. I think it could be helpful. I know these businesses, hotels, B&Bs, restaurants are getting crushed. I'm just waiting for a little more certainty. But anyway, we're coming back in November to balance a budget, and we'll make those decisions then.
So it really comes down to the budget being assessed and understanding if the CARES dollars can be put into the budget. What they can be used for. Exactly. And if I may, just on substitute teachers, I talked to a couple of teachers this week that said that they're being pressured by their administrators to work regardless, obviously not if they're sick, but to not use the personal days or sick time they're entitled to, that the numbers are that low. There's one district that said they literally have 0 people on their list. Aside from civic engagement, pride, whatever it may be, what motivation, because look, $85 is not a ton of motivation for someone to become a substitute teacher. Is it really just that?
Yeah.
Stepping up World War II style?
I think so. I mean, that's why people go into public service and teaching in the first place, which is they love kids and they want to do something good in the world. This is a once in 100-year crisis. It's a pandemic. These kids are going to be left behind for life. By the way, these poor teachers, as you say, they're working their tail off and there's no one on the sub list. So maybe it's $100 a day, which isn't a ton of money. It's, I think in Providence, closer to 150. I don't think anyone really goes into teaching for the money. They go into teaching because they love children. So it's a crisis. Lots of people are making sacrifices. Every day I hear of beautiful stories of people making sacrifices. Step up and serve at a time that we need you. But that's the answer.
Governor, the cases per capita is nearing the red line. What steps do you take if it reaches it?
I'll answer that, and then I'm going to let the doctor answer that. You mean for schools? Is that what you're talking about?
No, on the bottom line and the three on the dashboard.
Okay, data. I've got a lot of red lines in my life. We're trying to figure it out. The answer is it depends on what the rest of the data looks like. So, and that was what I was trying to express, perhaps poorly. If you are testing 10,000 people a day and you have a test positivity of 1.3, 1.4, 1.5%, it isn't particularly alarming that you're at 100 cases per 100,000 because we're testing so much. And the reality is when you test more, you find more cases. And on top of that, Paul, we're testing in places like Pawtucket, Providence, Central Falls, where we know we're going to find cases. So chances are, if we get to 100 per 100,000, which is the red line, but we're not dealing with mass outbreaks, the test positivity is well below 2%, hospitalizations are still trending down, we're probably not going to do much. But if we start to see some other challenges, then we might do something more.
Governor, the cases,
Right?
the more cases because of more testing is the logic that a lot of people got on President Trump for a couple months ago. I mean, it does show that more people are sick. And, one of the criticisms too has been that Rhode Island is using a positivity rate calculation that is different than other places are using, that Rhode Island is retesting a lot of the same people over and over, and an overwhelming majority of the tests are the same people. And if you just look at the new tests and the new positives, the rate is higher. Is the picture not as good compared to other states than is being presented?
So I can see the doctor chomping at the bit because she spent a huge amount of time on this, but I will say we report the data in both ways. We report it in the way other states do and the way that we do. And by both metrics, we are testing more per capita than pretty much anywhere except I think Massachusetts, and testing strategically. So for me, when I look at all the data, no matter how you slice it, that 1.5%, 1.3%, 2% in schools, it's a stable place to be.
The only piece that I would add to what the governor so accurately shared for both questions is that we are looking very pinpointedly at specific groups of cases. What we're saying is disaggregating them and looking at what's our percent positivity when we look at just colleges and universities. What's our percent positivities when we look at congregate care settings? And then how about those other cases that don't have K through 12 congregate care settings or colleges and universities? What are we seeing among those cases where there are local outbreaks? We are having very deliberate discussions between our data teams and the teams who can intervene on a daily basis to be able to go into our more densely populated communities and make a change, increase testing, make sure that people are getting into quarantine and isolation better, or intervene in our manufacturing companies where we are seeing a cluster, making sure that they have the systems in place that are needed. That approach is necessary as we're looking at cases. And it contributes to the increase in testing, and it contributes to how we are evaluating that increase. It's not just across the board. We're going in specific groups in a detailed way to understand how we can have a pinpointed, targeted response to each of the different outcomes that we're seeing in terms of cases.
Doctor, could you elaborate on vaccine distribution, what that would look like, the challenges? Do you expect there to be a significant challenge when it comes to skepticism from the public regarding the vaccine?
Yeah, it's an important reason why we pulled together such a robust, expert, informed subcommittee, because this is going to be a critical approach. And we've been planning for this for weeks, if not months, because of that understanding. We need to make sure that we have the data and the science to inform what people need to know about the vaccine. We need to be clear on how we are supporting the groups that most need the vaccine. And we need to have a targeted approach to messaging, because we understand the skepticism, the distractions, the messaging out there that can pull away from the facts and the data. And that's why coming back here for the Rhode Island information is key, because that's what we are going to stay strong on, the data, the science, and make sure that the people who most need the vaccine are the ones that we're focusing on how to message to them and make sure that they have the information they need to make correct choices.
Doctor, in weighing all of that, is there something specific to Rhode Island that you'll be looking at in determining the safety and the efficacy of the vaccine?
Well, one is what the governor mentioned in terms of building on the strong vaccine program that we have had in the state for years. That's a credit to our schools and school nurses, and a credit to our primary care providers, and a credit to our immunization program and all of the partners across the state. That's the foundation that we're going to base this on. That absolutely gives us a head start compared to other states. We're one of the few states that has a vaccine registry for children, and we've recently expanded to adults. We're not starting from scratch when it comes to that. So that's going to be the Rhode Island specific angle. We also have plenty of lessons learned from H1N1, which I had the honor of being involved in, as with many from across the state. We're going to build on that and be as successful as we can in reaching our goals.
Last question, Pat.
Governor Raimondo, in successive weeks now, there's been significant court cases handed down, both in Pennsylvania and Michigan. And while much attention was paid to Governor Whitmer's issues in Michigan, what's more intriguing, quite frankly, is the court case in Pennsylvania, where a federal court, not a state court, ruled that the congregate gathering limits imposed by defendants' mitigation orders violate the right of assembly enshrined in the First Amendment, that the stay-at-home business closure components of defendants' orders violate the due process clause of the 14th Amendment, and that the business closure components of the defendant violate the equal protection clause of the 14th Amendment. The judge, in his decision, went on to say that the basic liberties of the people cannot be subordinated to open-ended emergency measures. Given the weight that federal court has, as opposed to, say, in Michigan, where it was really a shot at a very well-defined state law, are you concerned going forward, particularly in the potential for a second wave, that your closure orders will have to be limited by this federal court decision?
No, that's not in our district. All of my decisions have been time limited, 30 days at a time, based upon the facts at that time, have all been evaluated at the end of 30 days and adjusted accordingly. Also, hopefully, we don't have to do another lockdown, because now we know what we're doing. You know, when I did the last lockdown, we didn't know how to test. We didn't know what contact tracing was. We didn't have any of these systems. So, no, I am not concerned.
Well, I think, Judge, in terms of the decision, was not so much looking at the states, your administration's ability to respond. I think that's not an issue. The issue is, in a second wave, caused by, shall we say, the natural progression of the virus in a wintertime condition. And is the court going to look at these constant 30-day orders as really, in the eyes of a defendant, an artifice?
I don't think so. It's a balancing act, right? It's a balancing test. Certainly I take people's civil liberties and freedoms incredibly seriously. This is nothing you ever want to do, ever. I would open every business tomorrow if I could. Having said that, this is a matter of life and death. So it's a balancing act. You have to balance the interest of public health and saving lives with our freedoms. And to me, these have not been, they're difficult calls, but that's why we do it for 30 days at a time, reevaluate, look at the health condition, and do that balancing act of business restriction, freedom restriction with life-saving measures. Again, as I say, look, you never say never, and I do think there'll be a second wave and the winter will be hard and we're gonna have the flu, but we are so much better prepared than we were that I really will do everything I can to avoid another lockdown and closure, because it's a serious thing. You're right, and it does take limit people's ability to live their life and do their business.